that, that purpose. Oh, I forgot to say, I'm sorry, I forgot to do housekeeping stuff. I was just so excited and just jumped right on in. The meeting is being recorded, and we will have this available for others to review after. And if there's anyone you know who is interested in this project, we can share that recording as well. And since we are a smaller group today, I mean, feel free to chime in with a hand raises, chat, whatever. If you have questions, we really want this to be an open dialogue and not necessarily us just talking at you. Back to the project overview, we're also looking at areas in the state where, I mean, quite frankly, we could build provider capacity in CHIRP across every part of the state. In fact, in most of our services, right? In particular, though, we do have an emphasis on expanding some residential capacity in the northern part of the state, the western part of the state, and south part of the state. The funds to be allocated are 1.5 million total are allocated for this grant project. That will be divided among, or could be divided among 3 awardees, may receive between $500,000 and $1 million each. And it must supplement, not supplant existing funding. We have extended the application deadline to August 31st. Next slide, please. I think I'm still doing this part, right? The eligible applicants.
Sure, go ahead, Michelle.
Okay. So who's eligible to apply for this? So it would have to be a currently enrolled CHIRP provider, or currently enrolled with the Colorado Department of Public Health and Medicaid as a program approved service agency, or PASA, or currently licensed as a child placement agency with the Colorado Department of Human Services, or currently operates at least one residential child care facility licensed by Colorado Department of Human Services, or currently is an enrolled Medicaid provider licensed and operating an equivalent to a residential care facility in another state. Next slide, please. Sorry, I just wanted to pause to see. I will go through this slide, and then I believe it'll be a natural pause to see if we have any questions. So I wanted to talk a little bit about what the funds could be used for, and then we're going to have some discussion and questions and try to generate some ideas with the group on creative things that we could do to use these funds to get at our end goal of expanding residential services. So allowable activities may include, navigation services to support discharge planning, case coordination and continuity of care in community and across systems, expansion of waiver services that are financially viable and person-centered, with a focus on those children who are at risk for being sent out of state for services. And I would add to that, or children who really are being kind of bounced around, experiencing extended stays in hospital. Those really are kind of mission critical for us as well. Creation or expansion of a step-down service between hospitals and short-term residential placement. Staffing costs that supplement work to expand CHIRP services will be reviewed with a strong sustainability plan in place. What that means is we could consider some proposals that would go to staffing costs. We would, because these are one-time funds, we would want to see in the application the plans for being able to extend that. So say if you were going to increase staff wages, that would only obviously be term limited with the grant. So we'd want to see a plan for sustainability outside of those grant funds. Next slide, please. Allowable costs. So I think I was wrong. I should have had the slides up to see where's a good place to stop for questions. I will stop for questions, but allowable costs, this grant could cover capital expenditures, training and education of staff, project implementation costs, project coordination costs, and program costs for each participant that are not otherwise billable to Medicaid. For example, home repairs, to create safe spaces, installation of plexiglass windows that you can't throw a TV through, kind of things like that. I would like to note that indirect costs are permitted, but only at 10% or $25,000 per award. So now I think is a good, before we get into more like discussion about really what these grant funds could be used for, I want to see if anybody has any initial questions. Okay, well, maybe we can go.
Michelle, this is Robert Wood. I'm sorry for the delay. I was just curious. You know, do you expect that this is going to be an annual type of grant mechanism? You know, that will carry through or is this designed for a certain period of time?
Yeah, thank you, Robert. Great question. And I just have to say too, nice to meet you. We very much appreciate all you do at your program.
Thank you.
Unfortunately, it is a one-time funds. So similar to the staffing costs, we would want to see anything that is sort of an investment that would require ongoing funding, that there's a sustainability plan on how to achieve that ongoing funding after the grant closes.
Thank you.
Thank you. Great question. Other questions? Okay, well, maybe we can go to the next slide. And I think this is where, Mara, maybe you were going to.
Yes.
Yeah, and I'm sorry, you guys, I guess I'm just not all together on a Friday morning. I didn't even introduce my fellow colleagues on the call. I just jumped right in. So I don't know if my HICPUB colleagues want to jump on and do introductions. I apologize for skipping past you, and you too, Mara.
That's perfectly fine. Yes, it is Friday morning for all of us. Yeah, I would just defer to Megan and others on the call from the department to introduce themselves first, and then we can have a little bit of this discussion.
Sure. So good morning, everyone. My name is Megan Haynes. I'm the Child and Youth Alternative Placement Model Advisor here at ICPA. That's a mouthful, but I'm working as the project lead on this particular ARPA project. So just grateful to be here and connecting with you all and having this wonderful discussion today.
And I think, is Phoebe's on, correct? I think that might be the only other department person.
Yes, good morning, everyone. Thank you for joining. I serve as our project support administrator for this and a handful of other ARPA projects, and I'm so excited to see this work in action.
Great. And I'm Mara Bear. I'm a consultant for the department on various projects, and I have been helping the ARPA teams with a host of things, including this grant project. And I was asked to help facilitate a dialogue with you all this morning to get a sense of how, based on what you know about this program, how you think it could be effective in your community, and learn a little bit more about if you've considered it or not, what are some of the variables that are affecting some decisions you might make about it as far as applying, given that the deadline's been extended. The group at the department is very interested to just get some feedback on where folks are at as far as evaluating this opportunity. And it'll be a great brainstorm too. So we're looking for you all to share thoughts, and don't be shy. This is a learning opportunity for everybody here on this call. And you may also, excuse me, while people are talking, type some things in the chat if that would be a better way to get your ideas out there, at least initially. So I think where I would suggest we start, and maybe going back to the slide that shows the types of uses of the funds would be good to help prompt our thinking. And when you were listening to Michelle brief you on this scope, I guess it would be helpful to get some feedback from folks based on what you see in community and where there are needs and what is allowed with this funds, what types of activities, community projects do you think would be viable or effective in meeting needs in the community? And have folks thought about that, or what is your initial reactions to what Michelle's presented with fund uses? Brownie points forever goes first. And Michelle, I would invite you and your team too, if you want to sort of share any thoughts of things you've been thinking about to get reaction from others in the community in the communities that they serve, of what might work, out there, if folks are feeling a little shy this morning.
Sure. I have not, I've mentioned this to several different people. I have not heard any feedback just yet, but I think talking about the fund uses, some of the things that come to mind, like I mentioned, we have a lot of excellent residential providers under CHIRP waiver, and a lot of them you all are participating on the call. We need more. We need more residential safe living locations for these children. So really thinking about how these funds could be used to develop that. We definitely we have a few new residential childcare facilities coming on board. We definitely have a need for that. Also, smaller group homes. I think there's a lot of room for growth with smaller group homes, and the capacity limits for the number of children who can be served in those group homes was increased this last year. So I think there's a lot of opportunity there. I do realize that, of course, staffing continues to be a really huge issue across the industry. But those are a couple of things that I can think of. And we always do need more foster care homes as well. Or, like I mentioned, it could be things like with your existing residential programs. Are there things that could be done that would enhance your residential services being provided at that home, make the home more safe? Again, I use the example of the safe windows or safe doors, items like that, potentially sensory equipment that would be installed at the home to help be able to support longer term, successful residential supports.
That's helpful, Michelle. With that, I guess I would just throw out to the group, when you're hearing some of the idea generation that Michelle's raising, what does it bring to mind for you as far as opportunities or barriers in community, or things that would build on some of these ideas? Have folks got any thoughts around that from the organizations represented?
I have a question. This is Shirley with Aerial Clinical Services. Is the funding, are we able to use that for not just sensory, but more like activity and behavioral approaches for the kids in the placement?
Hi, Shirley. Thank you. I'm glad you were able to join us. Yeah, I think broadly, yes, I think we'd be willing to consider that. I think we would have to make sure, one of the big things with all of our ARPA projects is we really have to make sure we're not supplanting anything that our existing services already provide. So if it was a type of service or something an agency would be expected to provide under that residential service payment, then it wouldn't cover it. But if it was something really above and beyond and outside of that, then we could consider it.
I think that would be a good conversation to have, because I think there's so many things that are not funded that might be helpful.
Yeah, absolutely. Do you have any like any specific ideas that come to mind?
No, not right now. I'm sorry, but I do know when we're talking as a group, a lot of times we're like, gosh, I wish this could be funded or whatever. So, but I can come to the table with some ideas and thoughts. I'm just throwing that out there right now as far as like just putting together ideas for the grant. Thank you though.
Thank you for that, Shirley. I love that idea. I think yeah, brainstorming that, and I think you can put those things together in your proposal, and maybe even as part of that, make the case like this isn't funded elsewhere. This is really above and beyond we're typically expected to provide. Yeah.
Okay.
Yeah, and I would guess to add on that question and comment, I'm curious from others in the group. Have folks looked at the proposed application framework, and thought about your proposed ideas at all? And has this raised any flags or questions as you're thinking about what you may be able to do in community? Are folks, anyone on this call, willing to share? You do have a potential idea that you're exploring, and if you haven't applied yet, what are some of the variables and factors that folks are thinking about that will impact whether you will in fact apply or not? It's important for the department to understand that and what barriers may exist, so that they can do all they can to support you all in this process and eventually getting grants awarded. So does anyone want to share if they've thought about this and what questions they still have in their minds?
Mara, this is Candace with Mission Possible, and we specifically do wraparound, and I can't answer your question in regards to actually looking at this specific grant because we haven't looked at it, but coming from the perspective of wraparound, again, we haven't looked at it, but some of the barriers that I would say that we've had, we work with CHIRP youth, and then we also work with youth and juvenile justice system, and they overlap at times. And some of the barriers that we've had is really looking at, and I have one youth, and there's been many, but one youth that really comes to mind wasn't quite 18, but there was a lot, like nobody would accept him because of the juvenile justice involvement and behaviors charges in like the group home residential setting. And so he sat in detention for multiple months. And so then it was like we were just waiting for, because no foster home would take him or no residential center would take him, because he kind of blown out of all of those because of the safety concerns. And so we were waiting for like him to turn 18 for a host home. And so through wraparound, like we went through multiple wrap meetings, multiple team members. And so we were waiting for that host home. We finally were able to find this amazing person who was able to help us find a host home. And so I honestly don't know enough about like how that worked, but like the host home, I don't even know how we did it, but like DHS was also amazing, and they helped with like funding the foster home piece of it for like a couple of days, and then it like a week, and then we got the host home to take over. And so there was like this gap, and again, I think it was called SILT funding, but there was like a gap of a week where we were able to get the kid out of detention, and there was like a week of some kind of funding helped pay for this, and then he got into the host home. But there's like this gap here where it was like somehow we got funding to pay, and it was only a week, so I think that was like our saving grace, but we were able to get him into the host home. But like there's a lot of kids who sit in detention because we can't get that gap paid for these months, and they just sit in detention. And while they're in detention, you guys all probably know this, they don't get any services. And so those are the gaps that I would see, like maybe this could be helpful, like if there is this other residential place where they could be housed and get those services under the CHIRP waivers, and get some of those services until they could get the host home or whatever that looks like. I could see that being helpful. And then I also could see like, this kind of scares me, I'll be real honest, like I'm like, oh my God, this kind of defeats like the purpose of WRAP. And I get scared because I'm like, our kids just, now there's going to be all these residential where CHIRP kids just get sent. But I could also see it being like, could wraparound be like that transition piece of like, okay, they're in this CHIRP residential instead of sitting in detention. This would absolutely be helpful. And then maybe we could get involved to help them transition out somewhere else, like to a different home instead of sitting in detention, because many kids do. Or like you were saying earlier, Michelle, like they get sent out of state. And so to keep them in their communities. But again, like that's what kind of comes to my mind is these kids get sent out of state and then they lose everything, and then they have to start all over somewhere else, and then they come back because families' private insurance can't pay for it, or they lose their Medicaid or whatever it is, and so then they get sent back and then they have to start all over. So again, I'm just trying to think, I think it was self-funding, but again, they lose everything. Or they just sit in detention. So I don't know if that's some of the community stuff that could help us, because in detention, they don't get anything. They literally just sit there.
Well, I'm wondering, Michelle, that's helpful information. Michelle, what's your initial reaction for how it could potentially fit into the fund uses framework that we have for this grant? I believe there is another wraparound services grant. I don't know if it's been released yet through ARPA, so I guess what feedback do you have on this one?
Thank you. And thank you, Candace. Very, I agree with you. All of what you said is absolutely correct. And you are right, that gap funding sometimes counties may use it still. I forget what it stands for, something about independent living placement, to cover the gap between the time until the child turns 18 or youth turns 18 and can go into a host home. Because as it stands now, a host home by itself can't be a residential provider for CHIRP for kids under age 18 unless they're also certified as a foster care home. So we do have that gap, and that is one creative way to meet that. You know, a grant applicant could apply for something like that. The only thing that would be of concern is that, again, we're looking for sustainability, and it would have to demonstrate how those funds could be, because those funds are going to go away. So what would be the, you know, sustainability moving forward? As a side note, we are, to sort of get at that issue, we are also looking at, is there any more middle ground between a foster care and a host home? Like, could we bring those together? So that we're looking at that with our partners at CDHS as well. But, you know, I like that idea. So if someone wants to be creative with it, but I think we'd like to see what the sustainability plan would be.
This is Shirley. I think that gap is such a big deal. And I don't really think that that's sustainability, because it's specific to the youth that is transitioning from the detention center to the agency. And that gap that she's identifying is that there's no services funded. So it wouldn't be a sustainability issue for the provider. It is more of a systems issue to close that gap. So I think that if the grant can't cover that because it has to be a sustainability issue, maybe this is something that should be explored outside of this grant, just as a side note, like a parking lot item, if you will, because we have run across kind of the same thing, except for there's a barrier. We had a youth that he was shot in a gang-related incident some years ago, and was needing a host home that could provide some home health care services, but also to the degree that we were looking at home health care coming in, and no home health care agency would touch him because he was in a gang-related incident. And I thought that was the first time I had ever come across something like that. But there's some services that are denying accepting individuals in because of criminal history, or, like I said, gang-related incidents, which could then cause them to either stay in detention, or in this situation, he ended up transitioning from being a juvenile to an adult in a nursing home. That's where he ended up going, because we couldn't get the care he needed at the level he needed in the community. But that wouldn't be a sustainability issue. That's more of a systems issue.
Yeah, Michelle, I think you're on mute. You were going to say something.
No, I was just waiting to make sure everyone was finished. Thank you, Shirley. Those are really excellent points. There are systems issues, multiple, particularly when people between corrections and eligibility with Medicaid. There's timelines, there's all sorts of stuff. So there are systems efforts underway, and I really appreciate that feedback. I mean, there are groups federally, there's starting to be some more flexibility with maybe when Medicaid can start while someone's still incarcerated, which would be excellent, because a lot of times people can't, they don't start their Medicaid until the day they leave the prison, and that's not helpful because there's no, there's nothing there. And I know a lot of providers step up in that gap as well. So that's being worked on. The host home, foster care home thing we're working on because that creates a gap. And then the other thing about that youth and home health not serving them, that's really interesting. And I know we have other providers who can be really hesitant to serve people after they're incarcerated. So I don't know if, something is that bringing it back to the grant, perhaps some training opportunities, creating like recorded modules that could be available for an agency staff and other agency staff, maybe on how to support people who've had criminal or justice involvement, or other creative ideas on how that could be addressed and supported, or educating the community.
And I think that the way I see that in my other ARPA work, and I would just chime in to help people start thinking of other ideas, is, sustainability is a little more possible in that kind of scenario when you've got training or research or building foundations that you could then take and build on in other ways once the grant funds are done. So any feedback on that or other types of research or training or education in community or in facilities and in other spaces where you serve, that could be valuable as you think about other gaps or challenges that you all are facing.
I just want to say that I think that the other issue, this is Shirley with Ariel again, that I think that we as a system are going to run up against is, for example, if we're going to open a group center, a group home, or foster parents, this is such a different type of provider, and the training that they require, I think, is so much, like the expectation of training and being able to apply the training and et cetera and performance. I think that the funding overall may still not address this population's needs, because we're not talking about a regular direct support provider. We're talking about somebody that needs to be able to do behavioral intervention on a regular basis in a living situation, and it supports the sustainability of the individual in that home, and not such a high rate of burnout, I think. And that's another thought of mine. But this is great funding to be able to train and to start that initial project, but to sustain it, I think, is a funding issue overall.
That's good feedback. Thank you for that. And that's, I think, what this team wants to know is, what are some of the challenges you would face in implementing this and maintaining compliance with the long-term requirements of ARPA, sustainability being a huge factor for all the ARPA grants. So I think that's really important for us to take back. Before I leave this subject of filling gaps and ask you a few more questions from the slide, maybe we can go back to slide 7. I think Megan's doing slides. Any remaining feedback on gaps? I think we've identified a solid area that could benefit from the funds if we can work out some of the challenges, but I'm curious, what would be other focus areas before we shift to a couple other questions? And folks can feel free to put a note in the chat. I know this group really wants to hear from you, from the department. So if you feel more comfortable reaching out one-on-one to the team to talk, that's also perfectly fine. The last few questions really on here have to do mostly with the fact that we've sort of extended this deadline, as you can imagine, because we're hoping to get more applicants. And so we have a few more weeks for that. So it would help to get a pulse from folks on whether you are considering applying, if there are questions generally or more specifically about that process, and what might be weighing your mind as you think about whether or not you will do that, whether it's internal or it has to do with the process. So are folks considering applying, and what kind of questions or thoughts are weighing in for you on that?
Ariel Clinical Services is planning on applying, considering it.
Great. Are others considering or hesitant to apply for various reasons that we can learn about?
Roundup Fellowship is going to apply as well.
Great. Okay, great.
This
Well-
is Josh at Pikes Peak Respite. I don't think we're going to apply at this time. There's unfortunately the sustainability after the grant for us to be able to provide respite, child youth mentorship, or even get into the residential side of this. It's just not there. There's too much liability, and it's just the training requirement is too high. We do services for the CES waiver as well. We can't get providers to do respite and child and youth mentorship because the pay rates are not high enough in order to keep those kind of skilled staff on board. And there is a significant difference between what we provide on the CES waiver for respite and other services than what we do on the CHIRP waiver. So that's where we're at.
Thank you. That's very helpful feedback. Any other similar feedback from others? It would be helpful to understand if other organizations feel similarly to what Joshua just shared.
I would just share, this is Palmer Johnson from Mission Possible. I work with Candace. And so I really don't have any words of wisdom, unfortunately, to help anybody except, well, not even except, but we just haven't had a chance to look at it enough to see if it's something that fits with us. I just didn't want to be an obstinate person that's not saying anything. We just don't have enough information to kind of weigh in one way or the other. However, just kind of what John, what struck me with that is we're very clearly, our efforts are focused on pre-placement or reunification or transition from placement to community. So I don't know enough about this to, I need to spend some time with Candace to just see, and Mary to see if it all fits. But anyway, I appreciate the opportunity to be on this call and learn from this.
Thanks. That's very helpful feedback. Appreciate it.
Yeah, I'll jump in real quick. My name's Tom Coast. I'm with Continuum of Colorado. Michelle, I don't think I've seen you in decades probably, so it's good to see you. So Continuum has been looking at being or wading into the child placement agency services. And I just got to say, I'm going to echo the sentiment here. The upfront cost that a provider would need to pay before we could even receive an individual and start billing is substantive, on top of some pretty serious regulatory requirements. And I mean, we're still trying to thread that needle because there's very clearly a need to have additional services in here. And so I'm late to the game on this. I just became aware of this grant. So I just jumped on to see kind of what the opportunities were. And I was kind of hoping that maybe there might be an opportunity to maybe have the grant fund some of those upfront costs. But yeah, it's, just from a trying to get started perspective, the system's got some pretty significant hurdles you have to climb over. Even if a provider is really wanting to get this rolling.
Thanks, Tom. I wonder, Michelle, as far as the startup funding question, do you have any additional perspectives on that you want to share?
Yeah, absolutely. And Tom, yeah, it's nice to see you. I don't think we've actually seen each other since my supported employment days when you were doing supported employment. Great question. I think, yes, startup is one of the things that we looked at for this grant. I think, again, we'd have to make sure that wasn't supplanting anything. So if there are certain things like certain basic training requirements staff have to meet in order to become a child placement agency, I don't know that we would be able to cover that. But I would encourage you to if you are interested, to submit that application and really think all those things through and talk about what those startup costs are. But yeah, that was definitely one of the things we wanted to look at through this grant. And I do know it is a lot. I think it's hard, and we continue to work with our partners at CDHS. It is hard when you're dealing with, we're not dealing with, that's a terrible way to say it, but when you're trying to support children, really vulnerable children and youth. And so you're right, it is hard to thread that needle of having those safety barriers and making it more bearable for people to come into the field.
That's helpful discussion. So we've clearly identified a couple of areas of opportunity. We've identified some barriers and challenges that may be specific to ARPA, and how can we be creative and stay within the lines of compliance that might be worth further discussion in one-on-ones as folks are figuring out their programs and might have more questions for the department team around that. Some opportunities potentially around these upfront costs that we just discussed. Are there other areas or things people want to share about where they are in their process and considering this opportunity that this team should know so we can help you?
This is Kelly from Colorado Behavior. I'm going to agree with Tom. The upfront costs are crazy. We're about 9 months in on our first home, and we didn't have any support through that for any grants or anything. But even the licensing side, getting licensed and being in a position where we can even potentially offer services to a high needs community for residential services has been just short of a nightmare. There's a lot of licensing requirements, and it would have been helpful, I think, to maybe have a guide for that. And I've talked to our licensing specialist about it a lot, just that I felt like there was a lack of support. While there's such a huge need, there's a lack of support on the licensing side and what actually I needed to get going and how our manuals had to be written out. And that cost, obviously, that's a lot of cost for us to even hire staff, train staff, all in anticipation of a license that's taken literally, we're almost at a year. So I think that would be really helpful. The funding is obviously, as Tom mentioned, it's substantial to get started. When there's no money coming in, there's no way to bill for those services because they haven't started yet. But the licensing side, I think for our company, we did apply for just to expand our program. But again, having that support piece as we started out a year ago would have been really helpful. So that would be some feedback.
Great. Any other thoughts on this? I feel like we've had a good, robust discussion. I feel like we've gotten through most of these questions on the slide. I don't want to pause and say we're done with the discussion until we hear from the department if they have any other probing questions for you. So I guess Michelle and Phoebe and Megan, do you have other follow-up questions for the group that aren't here on my slide that would help you?
I would just say, well, first I want to say, Kelly, thank you very much for your comments. So yes, those are, types of starting costs that we would be willing to look at. So if anybody, I think we have to entertain proposals. We can't say exactly, a lot of this is new. And so we would really think through that. But I think, again, startup is definitely something we're looking at. The other thing I was going to mention is, we did include training and training that's above and beyond what's required. The grant could pay for Also wanted to just plug another grant. If there's any of you who are thinking you'd like to really offer some specialized training to your team, your foster providers, whoever, we actually have a separate training grant as well. So if some of this other stuff, like it seems like, well, $500,000 seems like a lot of money, I don't need that much. I just wanted to point you to that training grant. It's 1.05, and there are 2 tracks for that training grant. There's one where the organization can apply, and one where individual providers, like the direct care workers, social providers, they can apply, foster care home providers. So if you're interested in just the training piece, that's another option for you. I'm not trying to direct you away from this grant in any way, shape, or form, but just that's a more broad training. Because I know a lot of you also provide other services outside of CHIRP. So if you haven't seen that grant, take a look, and I can try to put a link in the chat to that. But it could be a great opportunity to do things like trauma-informed care. We're seeing a big need, I think, particularly with children and youth, and I think it'll grow more into adult services, is some training around LGBTQIA and how to support our children and youth as they're navigating that, and the maybe challenges with when maybe family doesn't agree with that. We're seeing some of those situations that can be difficult. So those sort of more specialty trainings could be considered. Oh, and thank you, Megan. Megan put the link to that grant in the chat. But no, I think that's all I have. Megan or Phoebe, I guess I want to say I really appreciate the discussion and feedback today. This has been really helpful. You can also reach out to us, like Mara said, individually. But again, I just really, really want to thank you. This has been very productive, I think, on our end, and I hope for you all too. This time, Megan and Phoebe, I really will pause and let you chime in.
Thanks, Michelle. I don't have anything additional to add. I just want to echo gratitude for you all joining us today and engaging in this discussion. It is really helpful. As Michelle said, we'll continue to be available and a resource to you as you go through this application process, and certainly would encourage you to think on what we discussed today and really entertain an application. We're excited to see what comes through. And as a reminder, that deadline has been extended through the end of the month, so August 31st. And we'll put up our contact info here in just a second, but the ARPA email inbox remains open. We receive your messages and we act on those. So please don't hesitate to reach out.
And just to echo what everyone else has said, appreciate everyone's feedback. And as you noodle on this, please reach out with questions, even if it's not about the grant. I think we really do want to hear what our providers have to say and try to address concerns. Thank you very much.
So Michelle, I feel like that might be the wrap up, unless there's any last questions from this group. Okay.
Yeah, not seeing any. I think we can wrap up. Again, final thank you, and also thank you to you all for providing services to children and youth. We really appreciate you. And hope everybody has a great weekend.